It actually started 8 years ago. I was working out in my home gym, and all of a sudden I didn't know where I was, who I was, what was going on. And so my husband got me, and we went to the hospital because it was just bizarre.
I was a primary care physician. I wasn't able to keep up the speed of managing things along and keeping them straight.
In 2026, AdCare turns 40 years old. The primary goal is clinical research in Alzheimer's disease. There have been tremendous advances in Alzheimer's disease over the 3 decades that I've worked in this space. When I started here, there were no treatments available. The pathophysiological changes of Alzheimer's disease that can start up to 20, 30 years before you have any clinical symptoms. If we go after that, we might be able to prevent the clinical symptoms from emerging during someone's lifetime.
Early diagnosis has always been of utmost importance when treating dementia. All of the available treatments really work early on in the illness, whether it's mild preclinical illness or very early in the dementia process.
My neurologist recommended that I might want to be part of this study, this clinical trial. And it was through the clinical trial that I actually got the diagnosis of Alzheimer's.
With the initial diagnosis of Alzheimer's disease, fortunately I was able to get into a program of testing that gave me the opportunity to get early treatment.
When he was diagnosed, I was devastated. My experience as a geriatric psychiatric nurse practitioner was typically with people with end-stage Alzheimer's disease. I was very fearful. And when Tom was diagnosed, he looked at me and he said, "I'll be in a nursing home in 3 years." That was 2020.
In the past 32 years, I've done 350 clinical trials or more. AdCare has participated in trials of all the medications that have been approved by the Food and Drug Administration for the treatment of Alzheimer's disease.
We have patients that we know benefit from this work, and it keeps us going every day. Just because you're diagnosed with a neurodegenerative disease doesn't mean that your life is over. People can still look forward to the next 10, 15, 20 years. They have a diagnosis, but the diagnosis is not them.
So with the initial diagnosis, I was very scared of what was coming. Being able to get into a trial for new treatments really changed my view. At least I can do something that might move forward for those who will in the future have the same issue that I have.
African Americans suffer from Alzheimer's at a much higher rate than other ethnicities. And so the more people like me that can participate in this study, the better the outcome will be for those in the future. I hope I'm the tipping point for others to get involved.
We now have 7.4 million individuals with Alzheimer's disease and related dementia in the United States. That number is expected to double between now and 2050. All societies are woefully underprepared for this. We need to bring more resources. For us at AdCare, that has been through philanthropy. That has made the Alzheimer's Disease Care Research and Education Program the academic leader that it is nationally and internationally.
These kinds of programs can not only change a life, they can change a community, they can change the world. If anything, it's reason to live your best life.
What I hope I'm doing is to not have people wait until they're falling apart. I believe it helped me, and I believe it will help others.
I feel like we have already gotten 3 extra years. This is being seen as a chronic issue, not as the death sentence that it once felt like.
I think in Alzheimer's disease we have laid a solid foundation, and we will reap the rewards from that in the next 10 to 20 years. It will be an exciting time, and the University of Rochester is going to be at the forefront of that.